Hello, my name's Dr. Nina Josefowitz. I'm a CBT therapist and I teach CBT. I've taught cognitive behavior therapy in the Department of Applied Psychology and Human Development at OISE, which is part of the University of Toronto, for probably over 20 years. In addition to the U of T, I've taught social workers, mental health practitioners, a variety of people interested in CBT throughout North America. I've taught internationally, I've taught in Ethiopia, I've taught in India, and I've taught in China. I'm clearly a very committed CBT therapist and practitioner. And in addition to my work teaching and practicing, I've also published. I've published in the area of trauma, I've published in the area of forensics, ethics, women's issues, and I recently published a book along with my co-author, Dr. David Myron, called CBT Made Simple, which I think you would find very helpful as an adjunct to these sessions. It's a very, very practical book filled with lots of examples and cases. So we're here in the next couple of sessions to talk about CBT. What I'm hoping to do is give you a really thorough background in CBT therapy and in CBT theory, and help you understand how we can use CBT theory, in particularly what we call the four-factor model, looking at thoughts, behavior, physical reactions, and feelings, to understand our clients and to understand the vicious cycles they get into. We're then going to move to looking at different kinds of interventions. We're going to go over the basic cognitive interventions, which involves identifying thoughts, looking for evidence, and creating balanced thoughts. And we're going to go over the basic behavioral interventions. We're going to cover problem solving, behavioral activation, and exposure therapy. And then finally, the last two sessions, we're going to look at underlying beliefs, core beliefs and underlying assumptions, and how we can start to change those. What I'm hoping to do in these 20 sessions is give you a really solid foundation in a systematic way so that you have a sense of building on your skills. Now, homework and my workbook. So there is an accompanying workbook that goes with these sessions. You'll find some new material. Any figures that I use, you'll find them reproduced. And there'll also be some reviews of what we've covered in the session. Part of what you'll find in the workbook is homework. And I know people go, oh no, homework. I want you to think of the homework as a structured way of starting to apply CBT. The reality is you can enjoy these sessions, you can find me funny, you can find me boring, but if you don't actually practice what I'm talking about, it's not going to stick and be part of you. I have two kinds of homework. The first kind of homework is after each session, I'm going to ask you to apply CBT to your own life. I feel very strongly it's when you start applying CBT to your own life that you'll become a committed CBT therapist. And then the second kind of homework is are exercises to try with your clients, and try them. It takes courage to try something new, but let me encourage you to try the homework. Before we end this introduction, I want to give you a brief example from my own life, because it's when I started to become a CBT therapist, and what I mean, I wanted to give you an example of what I mean by starting to apply CBT to your own life. So dial back the time. I'm in my mid-20s. I'm an anxious graduate student. I just took my CBT class. I'm all gung-ho and interested, and I'm applying for the practicum of my dreams. So, very anxious. I'm in the bus, anxious the way you are when you're going to the practicum of your dreams for your interview. The bus is late, and it's late, and it's late, and it's late. And I'm looking at my watch, and I'm going to be 15 minutes late. This is a time, no cell phones, no way of getting in touch with anyone. So I start thinking, this is the end of my career. I will never get this practicum, let alone any other practicum. This is a complete and utter catastrophe. All of a sudden, I take a breath. I think of my CBT class, and I go, I'm catastrophizing. I may not get this practicum, but it's not going to be the end of my life. And that was the moment when I became a CBT therapist. It didn't take away my anxiety completely. What it did do was it gave me a space where I could sit back, take a look at my thoughts, and not just go down that automatic path that we can all go down, where you end up in this jumble of a black hole. By the way, I was 15 minutes late. I was actually a bit later than 15 minutes. My supervisor who interviewed me was absolutely lovely, and I did get the practicum. So I'm hoping to spend the next 20 sessions with you, and let's start the first session.